In this morning's Health Watch, women and stress. A new study finds that high levels of stress at work can increase the risk of a heart attack for healthy women by an astonishing 88%. Our Dr. Jennifer Ashton has the latest on what to look out for. Jen, good morning.
Good morning, Maggie.
That's a huge number.
Right. This study was presented out of this week's session for the American Heart Association, the biggest cardiology meeting in the world. And they looked at almost 20,000 healthy women, average age 57. Most of them were healthcare professionals, so anyone from a nurse's aide to a PhD, and followed them for 10 years. And what they found is that those who had a higher degree of job strain actually were at 40% increased risk for overall cardiovascular disease, and as you said, Maggie, an 88% increased risk for heart attack.
How did they define job strain?
Well, job strain for this study really included people who felt that they were in jobs where they had little or no decision making. They were very demanding jobs, and in particular, they didn't allow them to use their individual creativity.
So not necessarily the boss, but the worker bees.
Exactly, but again, this could be a PhD, it could be an RN. It wasn't necessarily someone at the lower end of the work hierarchy.
Got it. They also looked at the particular effect of job insecurity, which so many people are feeling in this economy.
Exactly.
How does that affect you physically?
So, right, as you said, job insecurity could be someone who has a job who fears they may be losing it, or someone who might be out of work potentially. But basically what they found is that those who stated that they had a high degree of job insecurity also were at higher risk for obesity, hypertension or high blood pressure, high cholesterol. All of those things, as we know, really stack the deck for us in terms of risk for cardiovascular disease.
Ideally, we would eliminate all that stress, but that's just not realistic. So how do you handle the stress in a better way?
Well, I think in general, and again, this is really important, Maggie, whether you're at home working, because remember, a lot of people work out of the home, or whether you're at a job place that you feel is giving you significant stress, you want to try to minimize the negatives and accentuate or maximize the positives. So obviously, one of the biggest negatives people should strive to avoid or cut out completely is smoking. How many times do you see people smoking outside their jobs, standing on the street? Skip it altogether.
And they do it as a stress buster, and it's having the opposite
Exactly.
effect.
It's the worst thing you can do for your health. Obviously, things like meditation or deep breathing exercises. If you can't leave your desk or you can't step outside and take a mental health break, just do some deep breathing. 10 minutes a day can really, really help. Obviously, avoiding junk food. We know, especially in the healthcare profession, that there's junk food everywhere. You know, the
Sometimes
water cooler.
it's all you have access to.
Exactly, but you really want to try to minimize that and try to eat more healthfully, even when you're at work. And lastly, if you can, take a walk during your day. I know near my hospital, I see a lot of the healthcare professionals in my hospital walking around the block, around the hospital during their breaks. That can do wonders, not just for your mental or psychological well-being, but for your physical well-being.
Do you find that stay-at-home moms have a similar level of stress as working moms?
Well, you know, they haven't done that study yet, but in terms of the patients that I see, absolutely. I mean, they're balancing a lot. There are a lot of balls in the air. They're working about their children, worrying about what they're doing at work, if they're working from home, and all of that stress can really lead to a reduction in your immune system. It causes chronic inflammation, and there are short-term and long-term consequences, and this study really showed that.
So your recommendations apply to all of them?
Everyone,
Every woman.
including men.
Including men, too. Dr. Jennifer
Absolutely.
Ashton, thank you.
You bet, Maggie.